Hey guys, I just want to say thanks so much for responding to my TED Talk and my questions. I thought you all had really good responses, and I just kind of wanted to touch base on all of your all's responses. So I, again, just really like this video because it talked about, you could relate this to a lot of different aspects of healthcare, finance, policy, kind of general patient care. There's a lot of stuff that you could relate this video to, so I really liked that aspect of it. And I think it was just one of those videos that really got you to think. And I feel like everyone kind of took this in their own way and gave examples and things. So I really do appreciate that thought. So just to start off, Alita, I really appreciated your response, is like your overall general response to the TED Talk with a lot of kind of some research and some statistics and kind of finding out what it really costs to care for someone with, for example, HIV, like you said, and what it could do, how much it costs in their general overall care, and then what they need to have in general resources to get that kind of care. I also thought you made a really good relationship to the kids with asthma. And if we helped control some of their environment, you know, paying their heating bill or making sure that they had their general allergy medicine or something like that, that it could prevent a $5,500 hospital stay. So I thought that helped make the video and the TED Talk really relatable. So I liked the examples and the research and kind of the thought process behind yours. Alexa, I really liked your examples. Some of the ones, I mean, I work at Children's too, obviously, and I had forgotten about some of the resources. So the ones about flying people around the world or the country, and just being reminded about all the work that our social workers and case managers do in our unit was really good. So I liked your examples and how we see, and just the reminding of how we see patients with limited to hardly any resources all the time. So I thought yours was really good. Jeff, I thought you took a really interesting stance on things, and I really liked how you talked about it, how if a program were like this were to work and to be implemented, really education would need to be a strong focus of it, not only to help the program do well and help those who really need it, but to also help prevent people from abusing the system. I think you're absolutely right. And I think every single one of us who were to think about our patients, and we could very easily come up with examples that where we've had patients and their families maybe abuse the system and take, and but yet they have money to do other things, other recreational things such as drugs or alcohol, and so they'll put that first above their basic needs and basic resources, and especially for their children. So we all know that that is a part of it. Not everyone wants to work hard and get to a place where they don't have to live with assistance, but sometimes there are people that just can't make it without assistance. So being able to differentiate those two groups, be able to educate those to help them utilize the system and the resources that are available in an effort to eventually get them away from using those resources. And then also being able to recognize those who just are going to use and abuse the system. So I think you had a really good thought process on that, and you know, aren't necessarily looking at the world through rose-colored glasses, which we all need to do, especially when implementing a program such as this. And Lisa, you also had great examples. I really liked your example of the little boy from Guatemala, and how you and your preceptor were able to talk to the mom and give some resources throughout the community of ways that they can meet some of those needs. So overall, I think everyone had great responses. I liked the different ways that you all responded, and the different kind of thought process that you had listening to the TED Talk. So I think this is definitely something that is important and will need to be done to improve our healthcare system in general. But it's going to take a lot of work and a lot of additional resources and manpower and time and money to make something like this work. So again, I appreciate all your responses, and thanks so much.